Hi there, my presentation today is going to be about the crested gecko and more specifically metabolic bone disease, better known as MBD, and how it affects this unique species of reptile. For those of you not active in the reptile community, you may not be familiar with the crested gecko. This is because they were discovered officially semi-recently in 1994, so we've only really known about their existence for approximately 30 years, which makes them a newer reptile species. Their name is the Cerelaphus ciliatus, and they are a cousin to the more popular leopard gecko. However, they are their own unique and distinct species, and they're referred to as a crested gecko and sometimes referred to as an eyelash gecko. This is because they have eyelash-like projections above their eyes. However, they do not act as such. It's just a loving name that owners and breeders like to use for them. Since being discovered 30 years ago, they've largely been domesticated. I think the first reason for this is their small size. A fully grown crested gecko typically is not going to be much longer than the length of a human hand. I think a second reason for this is they do have relatively simple care. I do say this as they are still a reptile, so they're still going to be a little bit complicated. However, they're a lot more simple than a bearded dragon or a snake, for example, and they're great for first-time reptile owners that want to learn. Finally, I do think they have a mostly calm demeanor. However, I will note that they can be skittish. These are not great class pets, or they're not great for a really social household. This is because crested geckos will typically bond with one or two people that they enjoy or at least tolerate handling by, and other than that, they prefer not to be handled and messed with. Partially, this is because they're very sensitive to temperature changes. They can overheat very easily, so when being handled by a lot of hot hands, it can cause them stress and overheating. So it's best for this to be an animal that only has one or two guests around at most times. They're not great for kids or really in an environment where they're going to be a class pet or anything of that sort. In addition, they're an arboreal species, so they enjoy tall environments with plenty of space to hide, and they are nocturnal. So you're going to see them most active eating, drinking, and climbing at nighttime. Occasionally, you'll see them out during the day, but for a majority of the day, they do prefer to sleep. So it's not abnormal for a crested gecko owner to not see their crested for a day or two because they're hiding or sleeping somewhere in the foliage or hideouts of their tank. When looking at the crested gecko, there's three major health issues that we like to investigate. The first is internal parasites. They're spread between crested geckos just as they are with any other species, so from animal to animal. It's important to keep an eye on your crested's stool samples to make sure that they look normal. Normal would be small, formed, and a dark brown color. If you notice liquid stools or abnormal colors such as yellow, green, or a light brown, that would be cause for concern for internal parasites and would probably recommend doing a vet visit if noticed. In addition to that, a second health concern is retained shed. Retained shed is where shed is stuck between the toes or around the base of the tail. Cresteds typically will shed their skin once every 30 days or so. I put an asterisk next to that because it does depend on the animal's humidity levels as well as how healthy the animal is, on how often they'll shed their skin, but it is typically going to be once every 30 days. If they do have stuck shed, it is important as the owner that you do not try to pull it off with your hands or with tweezers because crested geckos have very delicate skin, and if you pull it off, you can risk tearing their skin, which is very painful for them and can leave them open to other infections. Rather, if you notice stuck shed, what you should do is a stuck shed soak, which is where they're soaked in cool water and the water will loosen up the stuck shed and ideally it falls off naturally on its own. It's important when doing one of these soaks that you use cool water, not warm and certainly not hot because crested geckos are really sensitive to temperature. So warm water to us is blazing hot for them. So it's important to do cool water so that way it's a warm for them, but nothing warmer than cool because they will burn and they're very sensitive to temperature and they can burn themselves very easily. Finally, metabolic bone disease is going to be the predominant focus of this presentation as that is the major affecting health concern and fatality risk for a crested gecko. You may be asking, what is metabolic bone disease? Metabolic bone disease is caused by hypocalcemia, so low calcium, often due to a poor diet for the crested gecko. There's several symptoms that you should investigate if you feel that your gecko has metabolic bone disease, and those include soft jaw, wavy or floppy tail, trouble walking, or an abnormal spine curvature. The abnormal spine curvature is going to be the most telltale sign of MBD in your gecko. So if you ever notice that you feel your crested gecko has an abnormal spine, you should be consulting your veterinarian immediately. The crested pictured here has pretty severe MBD. I do believe he passed shortly after this photo was taken, but I think it's a great representative of several of the symptoms described. The soft jaw is a bit difficult to see in this photo. However, I think the abnormal spine curvature is pretty clear to see. The wavy and floppy tail, he's not really holding his tail up or around the person's finger. He's just kind of letting it flop down. And you can see how swollen the legs and the feet are, which can indicate that they're probably having trouble walking. Prior to going into treatment for MBD, I do think it's important to reiterate the fact that veterinary care for MBD is absolutely essential. A general practice veterinarian is not going to have the knowledge on reptiles and crested geckos specifically to handle a case of this magnitude, so it's really important to know where your closest exotic veterinarian is. The ARAV is a great source for finding your closest exotic vet, and these do fill up very quickly due to the lack of them. So it's important that if you start noticing these symptoms, you call immediately and get something on the books to have your gecko seen. However, I will go over some at-home remedies, but these are not in replacement of veterinary care. If caught early, treatment can start at home. Supplementing calcium, UVB lighting, those are the two biggest things. Supplementing calcium is typically going to be done with a calcium vitamin D3 combination, and UVB lighting is going to help them synthesize the vitamin D3 being provided in the supplements, and therefore it's going to increase their calcium absorption to help cure that hypocalcemia that they're experiencing. In an ideal world, we would prefer to not be treating MBD, but we would prefer to be preventing it. So how do we prevent MBD? Well, the first rule of thumb is to not feed homemade diets. Commercial formulas are the best by far because they have a proper nutrient balance and they're a complete diet for your crested gecko. They're researched by experts that know about their specific needs, and therefore they have everything that they need in one commercial formula. I have Pangea pictured here, and that's what I use for my crested gecko. It's great because it comes as a powder which lasts for a long time. You mix it with a little bit of water to make a paste, and that's how you feed it to your crested. In addition, crested geckos can have live insects a few times a week as a treat. However, it's important to note this does not replace the need for a commercial formula. However, when providing live insects once or twice weekly, it's important to dust them with calcium powder as pictured on the right, Rapashi Calcium Plus powder, before you feed them. This can provide them that supplemental calcium without necessarily needing to put it into their commercial formula. In addition, UVB lighting in your gecko's terrarium is essential. So UVB lighting is great because it doesn't emit excess heat. As I mentioned before, crested geckos are very sensitive to temperature and they can overheat very quickly, which can become fatal. UVB lighting is great because it doesn't emit any extra heat, so you don't have to adjust anything else when it comes to your gecko's terrarium temperature controls. In conclusion, crested geckos make for great pets. I have my crested gecko pictured here on the screen. Her name is Pancake. This was her when she was significantly younger than what she is now, so she was just a little baby here. But as you can see, she was small enough to just fit on one of my fingers, and she has been just such a great pet since we brought her home. However, there are components of her and other crested geckos' care which cannot be ignored. The dietary needs such as calcium and vitamin D3, the UVB lighting, the retained shed, intestinal parasites, they're all important to keep an eye on, as well as having an established relationship with an exotic veterinarian in your area. If you provide them with proper care, you're going to ensure that you have a healthy crested gecko, and they can live a very long life. It's been seen that in captivity they can live anywhere from 12 to 20 years, with an average being 15 plus years. So it's important to make sure you're taking great care of your crested gecko, and they'll take great care of you. If you'd like to pursue further research on crested geckos and specifically metabolic bone disease, these are the resources I used when making this presentation. I hope that you guys utilize these resources and others to further your research on the crested gecko.